So our next speaker, in fact our last speaker, is Dr Jane Beck. Jane is a retired medical practitioner. She's previously worked in the UK as a specialist in work-related medicine and was at a time a member of the Faculty of Occupational Medicine. And Jane is going to talk to us about, does water fluoridation serve the greater good? Let me open your presentation.
Thank you, Ron. Ladies and gentlemen. So you just heard that I previously worked in the UK, but I actually now live in New Zealand. And much of what I'm going to talk about today uses New Zealand-based statistics and things like that. But I think the principles broadly apply to here in Australia. And where possible, I'm going to make a few sort of comparisons and parallels. So I'm asking the question, is water fluoridation a good public health practice? Does it actually serve the greater good? Let's see, get my yes. In New Zealand, we have the Health Consumers' Rights Regulations, which appear to be very similar to the Australian Charter of Healthcare Rights. And these are the rights of individuals receiving health services, and it includes such rights as informed consent, services that are appropriate to individual needs, minimisation of harm, and the right to refuse or withdraw consent at any time. And these rights are reflected in the ethical codes of health professionals across the globe and go all the way back to Hippocrates, who said to first do no harm. Now, public health is concerned not so much with individuals, but with the health of populations. And so sometimes those health interventions do involve a choice of rights between the right to choose or a personal freedom and what is considered the public good or the greater good. And that's particularly the case for things like seat belts and cycle helmets. And we have those because we think it's beneficial to the health of ourselves and our children. But we don't actually have to swallow our seat belts or cycle helmets. There are some other public health interventions that we do have to swallow, and iodized salt is one of those. Often used in areas where there is iodine deficiency, iodine being an essential nutrient, and we certainly have it in New Zealand, and I believe there are areas here in Australia that are also iodine deficient, New South Wales being one of them. But we can make our choice about that when we go to the supermarket, whether we buy the iodized salt or not. And some of our municipal water supplies has chlorine added into it, and we have to swallow that. But chlorine is an integral part of our bodies, and the chlorine is actually added into the water to make it fit to drink. It cleans it and makes it fit to drink. However, when fluoride is added to our water supplies, we're drinking a substance that is foreign to our bodies because it is not an essential element, because it is actually being used as a medical treatment. And that substance has an effect on our bodies and remains in our bodies for years. As you're probably noticing, you're already beginning to hear information that you've heard already, because there is quite a bit of overlap. But I hope you'll forgive me for that. So fluoride is quite unique. It is the only medical treatment that is delivered to us through the water supply. So the rights that we are weighing up against each other are these health consumers' rights or our healthcare rights versus water fluoridation as the public good, for the good of children. Now, as was made clear in the 1957 Commission of Inquiry into the fluoridation of public water supplies in New Zealand, they concluded it would be unacceptable to fluoridate water if it was not considered completely safe, or if it was ineffective, or if there was an effective and safer alternative means to reduce tooth decay. And of course, it would also not just be unacceptable, it would also be unethical. And much has changed since 1957 when they made that, and 1953, I think, was what Jeff just said, was when they decided it was safe here in Australia. And not least, of course, the introduction of fluoridated toothpaste. So in order to establish if water fluoridation is safe and ethical and acceptable today, I would like to address these questions. Is it completely safe? Is it an effective public health measure that reduces tooth decay and health inequality? And are there any alternatives? When we're looking at the issue of safety, the first thing to remember is that the main mechanism of action, as you've already heard, is by direct action on the teeth, and there is no need to swallow it. And that has been known since the 1990s and is generally accepted. It is the swallowed fluoride that poses the health risks. And as we've already heard, it is not possible to control the dose. If we're drinking 1 litre at 1 part per million in a day, we'll be taking in 1 milligram. And if we drink 2 litres, we'll be taking in 2 milligrams. And if we drink 3 litres, like I do, it would be 3 milligrams. And it is not possible to take into consideration individual sensitivity. And this arises because we're all unique individuals of different ages, different weights, different genders, different genetics, and health status. And nor is it possible to monitor for adverse health effects. And we've already heard quite a lot about the adverse health effects. There's been quite a lot that has been associated with water fluoridation. And today, I'm just going to touch on endocrine disruption. In fact, it's been touched on a little bit today in the melatonin talk. The US National Research Council review, which we've already heard about quite a bit, published in 2006, concluded that fluoride was an endocrine disruptor. And as we've heard already, the NRC review was quite a significant review. It included 51 scientists. It was led by 2 professors and an occupational physician, and it focuses on the harmful effects only, so it doesn't look at the tooth decay aspect, it just looks at the harmful effects. And as Paul said, it's over 500 pages long with well over 1,000 references. So, and they concluded that fluoride was an endocrine disruptor. So what is an endocrine disruptor? Well, the endocrine system is our hormonal system. It's an intricate chemical communication system that regulates and influences almost all basic functions of life: our development, our growth, our metabolism, and our reproduction. And it does this through a system of glands. Maybe the mouse, is it the... Yes, so we've got the pineal gland, which has come up already today, the pituitary here, the thyroid gland, things like the liver, kidney, adrenals, and here's the pancreas. In women, ovaries, and in this hermaphrodite model, we've also got testes. And these glands, they secrete hormones into the blood system, which carries messages to other glands in the body and to cells throughout the body. For example, the pancreas here secretes two hormones, insulin and glucagon, and together they regulate the sugar level in our blood. And when this goes awry, we can develop diabetes. So the endocrine system is what actually keeps our bodies functioning normally. And an endocrine disruptor is a foreign substance that it disrupts the normal function of this endocrine system. And that is what the NRC review found that fluoride does. And they found that it does this even at the low exposure levels that we can be exposed to through water fluoridation. So what sort of things are we looking at? Well, just looking at the effect on the thyroid, the review reported that the fluoride exposure was found to be associated with the thyroid goiter, that's the increased enlargement of the thyroid, and altered thyroid function, which was suggestive of an underactive thyroid. And with a greater risk of these changes in the presence of iodine deficiency. Well, iodine deficiency is well known. We have it here in New South Wales, as in other parts of Australia, like we do in New Zealand, because we have iodine deficiency in the soils and waters, and therefore our foods. Now, I would say that a lack of research means that we really don't know exactly what level of impact this is having on the population, but we do know that there's a condition called subclinical hypothyroid, which is a low-grade underactive thyroid, which often has no overt symptoms, so we wouldn't really necessarily know that we had it. Fluoride could be contributing to this somewhat hidden condition, which has been associated with raised cholesterol, increased incidence of depression, and reduced IQ in children born to women with subclinical hypothyroid. And of course, it also may develop into the full-blown underactive thyroid, which is a relatively well-known condition in Australia and New Zealand, and particularly in women. And the effect on the pancreatic function could you pass my water bottle? Yes, thanks. Sorry, just a bit of adrenaline running through the body here. Thanks. Thanks. So they found in the pancreas it was exposure was related to a raised blood sugar and inability to clear that sugar from the blood. So in other words, type 2 diabetes. A condition that used to be seen just in middle-aged people and now is being seen in children as well. And Indigenous peoples, both here and in New Zealand, are particularly susceptible to diabetes. So fluoride ingestion from fluoridated water could potentially be worsening existing conditions of underactive thyroid and diabetes, or it could be contributing to their development, especially in when fluoride exposure is combined with other nutrient deficiencies and with excessive sugar consumption. So even just looking at this endocrine disruption in the thyroid and pancreas, and of course in the pineal gland, water fluoridation really cannot be considered safe. So, is it an effective public health measure for reducing tooth decay and for reducing health inequalities? Is it actually helping those people that are most at risk of tooth decay? And these include Maori and Pacifica and low socioeconomic groups, children in these areas, according to the Oral Health Survey in New Zealand. And Aboriginal and Torres Strait Islander Australian children are also more vulnerable to tooth decay. but the statistics that follow are the New Zealand-based ones. So the latest school dental statistics in New Zealand show us that the Maori, 42% of Maori are free of tooth decay, and only 37% Pacifica free of tooth decay, compared with 68% of the other ethnicities combined. And if we look at just the fluoridated areas for these 5-year-olds New Zealand-wide over time, what we see is this tooth decay gap has remained pretty constant over the years, with the other ethnicities hovering around 70% free of tooth decay, compared with the Maori, this red line, hovering around 40% free of tooth decay, and the Pacifica, the low mid-30s. Well, if water fluoridation was helping to reduce health inequality, we would be expecting these lines to be moving up towards the other. So clearly, water fluoridation isn't helping to reduce this particular health inequality gap. And if we look at the children who do have tooth decay, so that's the 40% of the children that do have evidence of tooth decay, we see that they have on average around 4 teeth affected by tooth decay. That's quite a burden when you consider that the other 60% have no tooth decay at all. And this has changed little over time. As you can see in the fluoridated areas, represented by the green line, it has remained pretty constant. And in the non-fluoridated areas, there has been some improvement, and it's come and is very close to the fluoridated level now. So clearly, not helping these particular at-risk children. And some of these children are going to have teeth that look like this. Some won't be so bad, and others will be worse. This is early childhood caries, and it's caused being put to bed by a bottle of juice, with a bottle of juice or a bottle of milk, or having it to sip on throughout the day, and hence is often called baby bottle tooth decay. And water fluoridation doesn't help to stop this, because only a change in habits will stop this. And the type of the severity that we see here will most likely require general anaesthetic for treatment. And in New Zealand, a study from Dunedin showed that children requiring general anaesthetic, 56% of them came from fluoridated areas, thus confirming that this early childhood caries is occurring as much in fluoridated areas as it is in non-fluoridated areas. More than 5,000 such operations are required each year in New Zealand, and the numbers are not being reduced by water fluoridation because it's not addressing the issue of habits, the excessive sugar consumption habit and the lack of toothbrushing habit. And it's only by addressing these habits that we can reduce the number of operations and make significant cost savings that could help promote health education. And that's what they did in Scotland, as Paul said earlier. They've saved £6 million on dental costs. That's about 11.5 million Australian dollars for a population of about 5 million people. And in the first 8 years of this programme, they basically halved their costs by reducing the number of operations and reducing the number of extractions and fillings in general. And they've done this by implementing the World Health Organization approach of promoting a healthy diet, low in sugars, and toothbrushing in schools, with regular dental care and extras for those most at risk. And they have not only just reduced tooth decay, but they have reduced some of the health inequality. And in the Waikato in New Zealand, a similar programme with the addition of the free vitamin D and calcium fortified milk. Vitamin D and calcium are important for healthy teeth, and vitamin D deficiency is well known here as it is in New Zealand, particularly in the winter months, and particularly in dark-skinned children. And vitamin D has been shown to reduce tooth decay. So we all want our children to have good teeth, and we want them to be fit and to be healthy. The message that's being sent out is that water fluoridation is delivering the goods without any need for behavioural change, but that really is not so. The complacent government policy is leaving children with bad teeth like this and leaving them at an increased risk of obesity, type 2 diabetes, and all the other health effects associated with excessive fluoride consumption and excessive sugar consumption. So water fluoridation is not serving the greater good. The alternative programs that I've mentioned, plus a national campaign to reduce sugar consumption and promote a healthy diet, would reduce the risk of tooth decay, diabetes and obesity, and all the other health issues that have been mentioned. And such an education-based public health programme is safe, and it's effective, and it's cost-effective. So fluoridation really is passé now. It's out of date to fluoridate, and worldwide the enlightened governments have recognised the risks of fluoridation and the benefits of education. The worldwide trend is to educate. So I say, let's educate, don't fluoridate. Thank you.
Thank you, Jane. Is there any questions? Comments? Yes.
You said chlorine was needed to make water fit to drink. You are implying that water is a poison, or I don't know what you're trying to say.
Yes, water has microbes in it, and the chlorine kills all the bugs.
That's what you should have said.
Yes.
That's what she's saying now.
And of course we don't need chlorine either. There are other systems like UV treatment, which are probably more acceptable.
We've got a question back here too, Jane.
Thanks, Jane. You mentioned iodized salt, and am I right in saying that chlorine, bromine, fluorine, and what's the other one? Iodine all compete in the body for, as in if you have one, they'll be competing to sort of get travel around the body. So in other words, if you have more iodine, it's going to lessen your intake of fluoride. Is that correct, or am I making that up?
Well, it's interesting actually, because I have heard that, and I've tried to find information to confirm that, and I haven't really found the information that confirms that.
Oh, okay. Right.
I think iodine, not being iodine deficient and having sufficient iodine, is protective against the effects of fluoride.
Okay, because that's what I'm...
Which is subtly different.
Right, because a lot of people we don't really use table salt anymore. You know, a lot of people use Himalayan salt or salt that's not iodized. So I think that we are even getting a further lack of iodine in a certain group of us are anyway, if we're not supplementing it some other way.
Yes, the Himalayan salt is very tasty, isn't it?
On that iodine issue, I just have to put in a plug for my weekly podcast, which is The Good Doctors Healthcare Unplugged. But we did a program, we interviewed Paul actually, that's how we got started on this. But we did a program on iodine deficiency with Professor Cresswell Eastman from Sydney University. I'm sure you know him, right? Yeah. Apparently iodine deficiency is the biggest deficiency in the world. 2 billion people in the world have iodine deficiency, and going back to high school chemistry, chlorine, bromine, iodine, fluorine, all belong to halogens. You remember that back in high school? And I actually asked Professor Eastman if you had a choice about a public health measure, would you fluoridate or iodinate the water? And he said, well, you know, really, Ron, I mean, fluoride's neurotoxic, so it's a no-brainer. There's iodine deficiency. So I heard it from him. And interestingly enough, you know, underactive thyroid. I mean, fluoride used to be used as a medicine to treat overactive thyroid. I mean, that was 50 years ago, I believe, the treatment for overactive thyroid. We know it has an effect on the thyroid. And interestingly, another book by Professor Samuel Epstein, Professor of Environmental Medicine in America, looking at cancer, noted, not connecting it to fluoride, mind you, that the incidence of thyroid cancer since 1975 has gone up 168%. I don't know, is fluoride implicated in that? I'm not saying that, I just think it's an interesting correlation. Correlation doesn't mean causation, but it's an interesting observation.
Just to extend the conversation about iodine a little bit more, there was a program on the ABC some years ago about an Australian doctor who went to the Himalayas. And he was iodising salt because in the Himalayas, because they are so far from the sea, there is no iodine in the salt. They have rock salt there. And of course it's a delicacy here, but it's not something that we rely on. And they were buying this salt from the gypsies, and it was rock salt. And so he was encouraging them to use the iodised salt that he was creating, because goiter, which is a result of very low iodine levels, was endemic in the populations there, and mothers with very low iodine levels are giving birth to cretin babies, and of course cretinism is a result of very, very low iodine levels. Apparently we only need about a teaspoon through our whole lives of iodine. And of course in high levels it would be toxic too, but we're not expected to eat the teaspoon in one day. And there is the choice with iodised salt, which we don't have in our water with the fluoride.
Is there any other questions, comments?
Perhaps this would be something that any one of the panel could respond to. It follows on a bit from Dr Beck's look at the question of ethnicity with Islanders and Maoris and Australian Indigenous people. What I'm curious about is, I can't remember the name of an American child specialist who is active on the fluoride debate, who said that socio-economic class-wise, which links in with questions of race and ethnicity, that the toxicity of fluoride that we have been focusing on all day can be counteracted to some extent by having well-educated habits to do with very, very good diet, having plenty of calcium in your diet and so on and so forth. You don't get quite so much pathogenic activity by the fluoride in your system. I'd like to see if any of the speakers would like to comment on that class differential on the adverse effects of fluoride between the well-off and the not so well-off in our world and our society.
Paul's got his hand up, I'll let Paul respond.
It's well established that fluoride's toxicity is made worse by poor diet. This is established in India in particular. Low calcium, low magnesium, low protein, low vitamins. And you're most likely, to answer your question now, you're most likely to find poor diet, low diet, in families of low income. So the families that you're precisely targeting for fluoridation, low income, are precisely those families that are going to be hurt most, and they're trapped. A, they can't avoid it, and B, their children are more likely to be more vulnerable. Now, if we go
generational,
yes, absolutely. And and this relates to my next statement. The last children in any country that you want to see have their IQ lowered are children from low-income families, because they've already got so many strikes against them. Pollution from inner cities, poorer diet, less educational opportunities. So many strikes against them. So, I mean, this is a classic case of good intentions going awry, because the very people that you want to help are going to be hurt most. by this practice, if we're right on the neurotoxic effects.
Okay, we'll have one more and then we'll wrap up.
I came to this thinking it was a pro-fluoride event, and I thought there'd be a lot of official people here saying how great it is. So I think it's surprising that there are so few. I mean, there's a quarter of the audience filled. But to those people who are pro-fluoride and have stayed on, I commend you, because it's very upsetting to have your basic understanding of things challenged and ultimately, shaken. So I think Winston Churchill said, the common man comes across the truth, might come across the truth at some time in his life, but he often falls over, trips over it, dusts himself off and runs away. So this is a challenge to your worldview to be here, and I've known about this for about 10 years, this issue, and I've talked to my mum and dad, and nah, you're crazy, you're listening to crazy internet things, and so if you can not just dust yourself off and walk away, just consult the information and try to change your worldview. It's very challenging, and you'll come up with a lot of opposition, but I think it's worthwhile to make a difference.
Thank you. I think that's a really great note for us to almost finish on. Okay, one more.
Just to make a quick comment, thank you, Jane, for a wonderful presentation, very easy to follow and addressed many aspects. The way I see this fluoridation issue is it's just adding another stressor. 21st century world is very complex, and we are constantly exposed to a lot of environmental toxins, and regulation is obviously quite complex, and some of the scientific facts often get neglected. So it's wonderful to have this sort of approach to discuss the science and to see what we can do at all levels of society, involving medical professionals, the medical system, as well as politicians. So thank you very much to the organisers and to the speakers for a very productive session today. Thank you.
Thank you, Jane.